you are, sir, joining the right wing in this killing field on health care. You will bring this bill down. You will kill it.
That is not what I said.
Will you kill it?
No.
Okay.
I would vote against it if I were in the Senate.
Well, that would be important since they need 60 Democrats.
Well, I mean, there are some alternatives. One thing they can do is strip the bill down. There's some good things in this bill. One is the exchange mechanism they use in Massachusetts. That's a good way to buy insurance. Two, there's money in there because of Tom Harkin for prevention and wellness. Bernie Sanders has some money in there for community health centers. There's good stuff.
What don't you want in the bill that's in there now?
I don't want all the goodies for the insurance companies. Here's what happens. We were promised that if we, in exchange for putting a ton of money into the insurance companies, which I was willing to do as long as there were other choices, that, for example, people with pre-existing conditions would be able to get insurance. Well, it turns out the insurance companies in the fine print can charge 300% more for those folks, for older folks, than they can for younger folks. So that's not really what happened. And there's case after case. You are mandated under this bill to buy insurance. If you don't buy it, you get fined, and the insurance company can take up to 30% out of your premium dollar and pay CEOs $20 million and put the rest in shareholders' pockets. This is a bill for insurance companies.
Wait a minute. They can do what if you don't do what?
The insurance companies are much less effective than Medicare. They take a ton of money out and put it in non-health care expenditures. If you buy a policy, which you now have to do under this bill,
right,
or pay a fine.
Well, some policy, the insurance company may take up even more than 30% of the dollars you pay. Well, go to some other insurance company then.
Well, yeah, but have you noticed that there aren't many insurance companies that get anywhere near the efficiency of Medicare?
Well, we don't have Medicare for anybody under 65.
Well, we could have. And that's
what government would you like to have pass this bill? Because the government we have right now has 60 Democrats in it. And one of those 60 Democrats is Joe Lieberman of Connecticut, who refuses to go along with it. So you have 59 Democrats.
Yeah, and you know
what are we going to do about it?
Well, luckily there's a procedure that's been used 23 times in the last 20 years, including recently by George Bush to pass tax cuts. That's what should have been done. It wasn't done.
But you can't do any of the reforms in insurance if you do it that route.
You don't need the reforms in insurance.
You're not going to do anything on pre-existing conditions?
There are no reforms on insurance. That's just what I'm telling you. If you can charge somebody 3 times as much for an insurance policy, how are they suddenly going to afford, even if you now say, well, the insurance company's got to offer it, you can't afford it.
So you would go through this reconciliation process and basically rip the Senate apart. You just do that?
No, the Senate will rip the Senate apart. It's been used before. This process has been used 23 times.
Create a new federal program
23
like this.
times.
When has it ever been used to create a federal program?
I would use it to...
Now, when has it ever been used to create a federal program as big as a seventh of the American economy?
I would simply expand Medicare. That's simple. That's all you have to do.
By reconciliation?
Yes.
And this would destroy the United States Congress.
Why would it destroy the United States?
Because the Republicans would simply say no more bills will be passed on any other matter.
Excuse me. We have used this 23 times before.
Not to create a major national program.
A major national program wasn't created by George Bush when he ran us into trillions of dollars of debt.
Yes, but what program did he create?
He created enormous tax cuts of every sort.
You're missing. You're dodging the question. You can't create Medicare. You can't create Social Security by reconciliation.
You can't create it, but you can expand it.
Well,
we already have Medicare.
It isn't Medicare if it's for young people. Medicare is for retirees.
Exactly the same. All you got to do is change the fine print and lower the age.
Okay.
Or, frankly, you could start all over again in 2 years.
This is demagoguery. You know it's not going to happen.
It could.
Why not?
Why isn't it?
They're not going to do it because it won't work in the Senate because it'll grind the Senate to a halt.
In 2 years,
it'll destroy the body.
We're not going to have 65 votes, 60 votes in 2 years. We'll have something closer to 55.
You don't have 60 now. You'd have Lieberman aboard. What would you do to Lieberman? If you were leader?
Lieberman is not the issue.
He's not. He's 60.
No, I mean,
he's number 60.
He can do what he wants. I mean,
is he a Democrat?
No, of course not.
What is he?
Well, that's a good question. You have to ask Joe. Look, I'm not interested in dissecting Lieberman or anybody else.
Why are you afraid to take on Lieberman?
I'm not. I'm hardly afraid to take
Everybody seems to be able to, I don't know, maybe
Chris,
it's good at fundraising.
I ran against the guy, right? I'm not hardly afraid to take on Joe. Look, the issue is this does...
When did you run against him? Oh.
For president.
I'm sorry, back in 2004,
That's right. This is not about Joe Lieberman. This is about whether we're going to have a decent health care bill in the country. Right now in the Senate, we don't have one. We have one that does some good things, but it does more bad things than good things.
Well, all I know is watching this the last couple of weeks, every time it looks like the Senate Democrats are about to unite around 60 Democrats and get something done and beat the filibuster, Joe Lieberman comes up with something over the weekend, usually on a Sunday television show with all the cameras going, and he says something like, well, not the public option, no, and oh yeah, my staffer, whoever put the word out this weekend that said I'd go along with the buy-in at 55, age 55 for Medicare, that's not going either way. He's like Lucy in Peanuts. He holds the football till Charlie Brown's about to kick it, and then he drops it. And now you won't even take them on.
I'm not interested in discussing Joe Lieberman. I care about health care.
This is it.
Look, the culture in Washington is, Joe Lieberman.
It's numbers.
It's so-and-so.
It's 60. Now how democracy works is the reason you didn't get elected president. It's numbers.
Yeah.
You have to get a certain number. In this case, to stop a filibuster, you need 60 votes.
You know what the problem is,
Lyndon Johnson was able to do it with civil rights. They haven't been able to do it because they can't unite their own party.
So I'll tell you what the problem is. The problem is not 60 votes or George or whoever, Joe Lieberman or anybody else. The problem is Democrats aren't tough enough.
Oh, okay.
So
it's an adjective that's missing.
If we were the Republicans right now, this bill would be done through reconciliation. Done, just like Bush did and just like 23 other times it's been done. We're not tough
Let me
enough.
ask you a question. We have 60 Democrats in the Senate. We have 59 plus Lieberman, who's an independent, used to be a Democrat. How come none of them are willing to go for reconciliation? They don't want to do it.
I don't know.
You're not a senator. So you know something they don't know.
What I know is it's been done 23 times in the last 20 years.
Not to create a massive national program. It's not supposed to be used that way.
We don't need
reconciliation. I worked on the Hill in the Budget Committee for years. I know what it's for. It's to reconcile what Congress passes as legislation with the budget numbers. It's not there to create new programs.
I'm not asking to create a new program. I'm asking just to do just what George Bush did. George Bush had existing tax cuts.
Let me ask a member of the United States Senate. Thank you, Governor Dean.
Thank you.
I know where you stand. Go with reconciliation. Let's